day, I'm Sunay van der Walt and I would like to present to you the results of our student survey on perceptions of strategies used in the teaching and external factors affecting the learning of anatomy at a South African institution. Anatomy is considered as one of the core subjects in the curriculum of health sciences and medical students to prepare them to conduct physical examinations, understand patient symptoms, and to diagnose patients. The modern medical curriculum has brought about great change in the teaching of anatomy, becoming more student-centered, integrated, problem-based, and clinically relevant. However, how we teach anatomy and which strategies we implement are of importance. The study aimed to determine which teaching strategies and external factors affected the learning of anatomy of second-year medical and physiotherapy students and first-year nursing students. The survey was distributed via the learning management system. Hands-on practical lectures and dissections were perceived as the most effective teaching strategies, which coincides with published literature, while visiting the Anatomy Museum was identified as the least effective. Rotating lectures and group work was identified as factors influencing the study of anatomy positively, while strikes were by far the most negative factor impacting students' learning. Teaching strategies and the effectiveness thereof often lead to heated discussions in anatomy departments as tertiary institutions migrate to a student-centered learning approach. Practical lectures and dissection sessions are all student-centered, which highlight the efficiency of migrating from a teacher-centered teaching approach to an innovative student-centered teaching style, which challenges students to learn with their whole brain.
This video was partially sponsored by the USANA Plus, an EU-funded project.